Chapter 19, Reproductive. It's titled Reproductive and Genetic Disorders, but the genetic content we covered in Unit 1 in conjunction with Chapter 7, so this is going to just focus on the reproductive content from this chapter, and this is a supplement to Chapter 11 on adolescence, so those should both be being viewed simultaneously. Okay, so we're going to focus on just some important anatomical differences between the male and the female's reproductive systems, and then how does that result in some important pediatric reproductive health concerns that we see. So some things to consider that, puberty is going to affect both genders. In girls, some of the important differences is that the onset or when it takes place is going to differ based on race of the child. So we know that racial and ethnic differences exist, and specifically like black girls will typically experience onset earlier than white girls will. And that's just one example for that. Some important words to learn, medical terms, have to do with when and kind of the condition of those puberty changes. So adrenarche is referring to when the adrenal gland starts to produce sex hormones in the female. Pubarche is the appearance of pubic hair, so it's when that's first discovered. Flarche is the appearance of breast tissue maturation, and then menarche is occurring when they have their first cycle or their first menstrual period. I don't think there's any test questions that speak to any of this, but it's important to understand some of these terminology just in reference to medical education. So some problems with the female genital tract that we want to be aware of that are very common in pediatrics include genital and urinary complaints. Usually the things to be mindful of is what's the age of the patient when they present, what kind of activities is the patient involved in, is the child potty trained, are they one who bathes or one who showers, to what degree have they experienced puberty changes or sexual maturity, because all of these things can factor into helping determine what's actually going on. Never want to rule out sexual abuse. Unfortunately, it's way more common than I think is reported. So depending on what kind of symptoms they're manifesting, that may need to be something that's considered. If they're seeing bruising in the genital region, that is not an expected finding, and so there needs to be some further examination by an expert that's being performed. One of the more common infections, actually, because I shouldn't say infection, complaints is vulvovaginitis, which is inflammation of the vaginal area, specifically the vulva. And symptoms for that typically include vaginal itching, which we know as pruritus, vaginal pruritus, soreness and redness to that area, so erythema, and then thin vaginal discharge. And that discharge may or may not have an odor to it, but typically there's going to be some discharge that occurs. For some, it even includes having pain with urination, or dysuria can be a possibility for them. Typically, there is an infection that's the cause of it, or it could be some kind of irritant, like wearing too tight of underwear or taking a bubble bath. Or some people are just really sensitive to certain scents and perfumes in different hygiene products. So it doesn't have to be infection. It could just be a severe irritation that's causing it. But some education points should include hygiene practices like using moist wipes, having underwear that allow for airflow like cotton underwear, not using these scented and, other fragranced soaps if they're more sensitive. Patting dry instead of wiping can help as well. So teaching them some of the ways that they can manage that uncomfortable condition, whether it's inflammation or infection or both. Excuse me. When talking about vaginal discharge, it's important to ask for as much information as possible, like how often is it experienced, what color is it, are there other symptoms associated with it, is there a particular smell or a texture to it, and also, doing the same thing anytime a patient reports bleeding. We want to try to get a careful history to determine like when was its onset, is this part of normal menstruation patterns, is this part of the initial onset of menses that's contributing to it, is there maybe contraceptives being used that could affect the bleeding frequency and amount, the degree of sexual maturity the adolescent has experienced. All of those things are very important when when completing these forms of assessments. In the majority of females with bacterial vaginosis, this is something that there's minimal symptoms in the majority of females. So it sounds like 50 to 75%. But what they tend to include is a foul odor or even a fishy smell and a discharge that's thin, whitish to gray colored appearance. It's associated with sexual contact most of the time. And we see it in adolescents once they've started having a cycle. And obviously that would include also childbearing females. So BV or bacterial vaginosis is not typically associated with an adolescent who hasn't started having menstruation or menstrual cycles. With vaginosis, there's usually not any inflammation to the vagina. There is this discharge and this odor potential, and that's pretty much their only symptoms. It can resolve spontaneously, but sometimes it does require treatment. Abnormal uterine bleeding would be another adolescent vaginal complaint, and that typically has something to do with hormone changes. It can also have things to do with other potential underlying factors that the patient may be experiencing. Menstruation, when active, is actually the shedding of the uterine lining. And so some other important terminology to consider is amenorrhea or menageria. Amenorrhea is the absence of periods or the absence of a monthly menstruation. If they have primary amenorrhea, then that means they never have started having cycles. So it's not like it's stopped, it's that they've never had it. But secondary is once there's been an onset, then there's an absence of those menstrual cycles for at least 3 cycles or a 6-month time frame. Menageria is an excessive menstrual cycle or menstrual flow greater than what is their norm. Usually it's because it's heavier in volume or it's a period that's lasting longer than the adolescent's typical length for that. And I have in here just some additional information. Active shedding in the endometrial lining of the uterus occurs in a cyclic fashion in response to estrogen and progesterone hormone changes. Cycles in teenagers are often irregular, especially in the first few years when they first start having a cycle. That irregularity has to do with how many days between their periods they have, and that will change often from month to month. But they should get to a point where there is some consistency or routine to it, and when that is not the case is when we utilize some of these other descriptors. Okay, in terms of our males, our boys, changes that occur in puberty include the enlargement of the genital area, so the length of the penis, and also the size of the scrotum and testicles, developing pubic hair, increased body hair elsewhere, like arms, legs, underarms, face. I mean, that happens very often as some of the initial changes that are occurring. Their voice deepening, and then they also will have that rapid change in skeletal and muscle growth. So the common problems that we would expect, we need to focus on, just like with the female, what's the age of the child? What activities are they involved in? You know, are they already potty trained? Was the child circumcised? And to what degree have they experienced sexual maturity? So this is obviously not adolescent based like this next topic of circumcision. Typically that is performed in the newborn period. But, you know, for those who are circumcised or who aren't, there can still be issues or complications later in life associated with either. So with circumcision, some things to note is that is essentially an elective procedure in which foreskin is removed. Its purpose is to reduce the frequency of urinary tract infections, inflammation to the penis, disorders associated with you know, any kind of excessive skin. It does reduce cancer risk in terms of penile cancer, and it also can help to minimize transmission or spread of some sexually transmitted infections. All in all, for those who are circumcised, the practices for hygiene are generally easier because they're able to do a more thorough job. They don't have that excessive foreskin that is potentially in the way. With an uncircumcised penis, things that, you know, need to be considered is that if you ever cannot retract that foreskin, that is referred to as phimosis, and we do want to discourage forced retraction. That doesn't mean you're not cleaning the penis head. You do still need to be able to, you know, pull back some to be able to perform that necessary hygiene practice, but forcing it can actually be very dangerous as far as infection risk and bleeding. When somebody does not have dissension of their testes or their testicles, that is referred to as cryptorchidism. This is a congenital condition, and usually that's occurring before they're even 2. It may not be that that was discovered that young, but it should be then that it occurred. So what typically happens is that, you know, when we see a baby who's a newborn, we're evaluating for their testicular dissension, but if it hasn't happened, you know, we can allow some time for that to occur on its own. And, you know, typically it will. But if we get to the child and they have still not had that occur, then we want to make a referral to the urologist because they could need surgery. And that surgery is hopefully going to be performed before they're 2 years of age. And the surgery can be done to actually help manually descend the testes. Scrotal swelling is a possibility, and it can vary in severity. There's benign and forms that are considered medical emergencies. There's painless and painful forms of scrotal swelling. There's chronic and there's acute. So it just depends on the patient. A hydrocele is what we basically refer to as a fluid collection. It surrounds the testes and it's painless for the patient. And a way to diagnose it or, you know, confirm it is transillumination, where you basically put a light or like a flashlight up against the scrotum, and if that light easily passes through the area, then it's what we would consider a hydrocele. This can happen anytime for the male patient, but often later in life. We do see it also very often in newborns, so kind of the two different extremes. And many times it'll self-resolve, so it'll go away on its own. It's like the body will basically absorb and redistribute that excessive fluid. A varicose is a collection of veins in the scrotum. painless for the patient. It is what they refer to as a texture that mimics a bag of worms. If you choose to go on to get a master's and you go through Magnese's program for the advanced practice registered nurse, you will get to, in your physical assessment course, you will come to campus and have labs in which you will get to experience some of this. They have mannequins that illustrate some of these situations. So for this patient, it can be that they're asymptomatic, not having any symptoms, or that they experience what they refer to as a dull ache or a fullness feeling in the scrotum when they're standing. Excuse me. Says that when palpated, it'll resemble the texture of a bag of worms, and it can be that they become fuller anytime they're bearing down or experiencing the Valsalva maneuver. This can contribute to infertility. These patients need to be monitored. You know what? I think this infertility thing is speaking to testicular torsion. So for the varicocele, I don't think that that's the case. I apologize. I'm trying to read notes on a very small screen while I'm recording this for you. Okay, so the varicocele, what I didn't include in this slide and what I need to be able to speak to is if it requires any treatment or if it is self-resolving. So let me look at your book and see what it says. It could require surgery. Yes, it basically just speaks to surgical treatment, and since it's usually painless, there's typically fewer other symptoms. Sometimes they'll let it see if it'll go away. Let's see, varicoceles typically do not resolve on their own, so a procedure will be required, either in the form of surgery or what they consider embolization, in which they break up the cluster of veins or collection of veins. Okay, testicular torsion. This is a big one, and I hope you've heard it before now, and if you haven't, when you get to GU with med-surg, you will. But this is what is considered an emergency that requires surgery, and it is often seen in our adolescent patients between ages 12 and 18 years old. With this, what is happening is there is twisting of the testicle, which is obviously going to impact circulation. It is painful. The patient experiences scrotal swelling and both abrupt and severe constant pain occurring in the scrotum, groin, and even as much as the lower abdomen. It mentions intermittent versus constant in that they can experience not flare-ups, like pain that subsides or there's some relief and then it returns, but in any case it's an emergency that needs to be surgically addressed. This is the one that can be associated with infertility, and that individuals are going to be monitored through the teen years because of the need for aggressive surgery if this occurs. Okay, epididymitis is inflammation of the epididymis, which is associated with infection. So this is a situation where infection's creating the inflammation. With this, the patient will experience profound swelling. It will be painful for them to urinate, and that pain will worsen over time. They may experience a discharge, they may have a fever, and there may even be visible redness and swelling to the scrotum. Typically, this is associated with some form of chlamydia, gonorrhea, or E. coli, so some kind of bacterial infection. We see it often in younger boys, so pre-puberty, and it's what they refer to as idiopathic, which means spontaneous onset. We don't know what leads to it. And then for treatment measures, it would include antibiotics for the specific bacteria that's causing this infection, and then possibly surgery to clear the infection. Okay, and our last slide is a continuation of the male genital problems and includes orchitis and a hernia. So orchitis is inflammation and infection of the testes, also painful, also associated with scrotal swelling, can have redness. But what's different, or what kind of stands out in this situation, is that there's this shininess to the skin overlying the testes. So that's something that's unique to this condition. And if it's determined to be bacterial in origin, then obviously treatment would include antibiotics. But other management would be supportive care, like taking nonsteroidal or anti-inflammatories, having, ice packs applied, sometime on, sometime off, not directly applied to the testes. There should be a barrier between them. And then bed rest for this patient as well. And then the last condition would be a hernia, which we've talked about already in this content, growth and development content, that it's a protrusion of an organ or tissue from an opening that's not supposed to be there. And so the most common types we've discussed previously can be umbilical, which are usually benign, non-tender, self-resolving. See it usually go away by a couple of years old. But inguinal is one in which it's in the groin or the inguinal region. That often will happen with males, and that does require surgery. It'll present like a painless mass. Sometimes it's visible, sometimes it's not, depending on the patient's positioning. But with it, it can become dangerous if it becomes incarcerated or strangulated, which is going to constrict blood flow and result in necrosis. So in that situation, it would definitely be painful. And usually, like I said, it would require surgery anyway, but if it leads to that point of incarceration or strangulation, then it's an emergency surgery for that patient. We talked about this previously, I guess maybe in the infant chapter, but a lot of times they'll have it unilateral, so it's just be on one side, but anytime a patient has had that, they are at greater risk of having one occur on the opposite side. So once the surgery is performed for the existing inguinal hernia, they still have to be monitored closely for potential occurrence of another inguinal hernia. Okay, and that is everything for Chapter 19, Reproductive, which again is part of the content being taught for adolescent. So this information will be tested on together.